What can you expect from cholinesterase inhibitors for dementia? Imagine a medication that can give a little boost to memory and thinking skills for a while. That's what cholinesterase inhibitors do for people with certain types of dementia, especially Alzheimer's disease. These drugs work by increasing levels of a chemical called acetylcholine in the brain, which helps with memory and learning. In dementia, acetylcholine levels are often lower, so these medicines aim to make up for that deficit. People taking cholinesterase inhibitors often notice small improvements in their thinking, memory, and ability to handle daily tasks. These benefits can last for several years but are usually temporary because the brain damage from dementia continues over time. Studies show that those on these medications tend to decline more slowly than those who do not take them. Some research suggests they might even delay reaching severe stages of dementia, though this varies from person to person. While these drugs are mainly used to treat symptoms, there is some evidence they may slightly slow the overall progression of the disease if started early. For example, one medication called rivastigmine has shown some promise in delaying cognitive decline and possibly influencing how quickly the disease advances. Additionally, using cholinesterase inhibitors has been linked to a lower risk of death in some studies of Alzheimer's patients, but more research is needed to confirm this. Cholinesterase inhibitors can also help with neuropsychiatric symptoms like agitation, depression, or mood swings, and they may improve a person's ability to function day to day. This can make a big difference in quality of life and ease the burden on caregivers. These medications are most effective for Alzheimer's disease, though they are sometimes used off-label for other types of dementia like vascular dementia. Their benefit in Lewy body dementia is less clear, with some studies showing limited effects. It's important to remember that these drugs do not cure dementia. Their effects are modest and tend to lessen over time as nerve cells die. As the disease progresses, the medications become less effective, and symptoms may return or worsen. Patients and families should understand that cholinesterase inhibitors are part of symptom management, not a cure. Side effects are common and can include nausea, diarrhea, muscle cramps, and fatigue. Because they can lower heart rate and blood pressure, caution is needed for people with heart problems, asthma, ulcers, or liver and kidney issues. These medications should not be used with drugs that block acetylcholine, as that can reduce their effectiveness. Starting treatment early can sometimes provide more benefit, and regular check-ins with healthcare providers are essential. They can monitor for side effects, evaluate how well the medication is working, and make adjustments if needed. Treatment plans should always be tailored to the individual's health, type of dementia, and how well they tolerate the medication. In summary, cholinesterase inhibitors offer a modest boost in thinking, memory, and daily functioning for many people with Alzheimer's disease. They may slow some aspects of disease progression and reduce the risk of early death in some cases. But they are not a cure, and their benefits are limited. Always consult a healthcare professional to determine if these medications are appropriate and safe for each person's unique situation.